Thanks for that, Anthony. A slight dip in new COVID cases in Georgia after 2 days of record-breaking numbers. Today, the state reports close to 18,000 new cases, about 2,000 less than yesterday's high of nearly 20,000. In South Carolina today, the state reports the highest numbers since September at close to 6,000 new cases. The rise in cases has state lawmakers responding. Georgia Governor Brian Kemp getting ready to deploy about 200 troops of the National Guard next week. While he was in town today, we asked him how many he expects to come here to Augusta. He says they're still working out details, but they plan to send more than just medical staff.
It's not just medical people that they need, whether it's doctors, nurses, respiratory therapists, but just also people working in the dining rooms, custodial staff, transportation, logistics, checking people in. So we'll try to help augment the National Guard staffers with that too.
South Carolina DHEC recommending you rethink your New Year's Eve plans given the latest data. In new data released this afternoon, it shows hospitalizations up 42% since last week, and patients in the ICU are up 10%. DHEC also says it recognizes testing is in high demand and it's working to increase it statewide. Our state and local health experts are once again asking you not to go to the emergency room to get tested for COVID unless you're experiencing severe symptoms. Both AU Health and doctors' hospitals tell us their ERs are full of patients wanting to get tested, and that's taking resources from real emergencies. Here's News 12's Sloan O'Cone with a closer look at the strain on the entire system.
This time it's a little bit different than the previous times. If the folks are not as sick, the symptoms are less severe, but there's a lot of concern in the environment, and that is certainly resulting in increased volume and wait times in our emergency department right now.
Concerns over a positive test and others looking for an answer.
Many of those are presenting for testing, which is not really an appropriate use of the emergency department and really unnecessary and kind of clogs up the system for others who may be suffering from other emergency medical conditions.
People experiencing heart attacks, strokes, severe COVID symptoms, any emergent or urgent health issue are encouraged to go to the emergency room.
Seeing a lot of a full waiting room, and it just seems like it remains full.
We don't want to discourage people to come for those conditions. What we do want to discourage is those that don't necessarily need that level of care and can obtain it in another venue.
As we approach a new peak in our local positivity rate, 34% of all test positive, Omicron's incubation period is shorter, so more people are getting infected faster with mild symptoms. Despite positive cases, the numbers are not being reflected back in patients with COVID in the hospital. Our local health officials want to emphasize they are here to give you the care you need, but to make sure you're going to the right place for it so you aren't taking care from someone else who needs it.
So where should you go to get a test? You can go to any of Georgia's Department of Public Health sites, and these are a look at the locations and hours for the ones in our region. The Richmond County Health Department is open from 8 a.m. to 2 Mondays through Fridays. You can also go to AU site downtown Monday through Saturday from 9 a.m. to 3. There is also testing available at our local CVS, Walgreens, and MedNow locations on both sides of the river. We're hearing from Columbia County about its plans to return to the classroom next week. For now, the superintendent says they're working on going with the same precautions as before the break. That means masks are optional with as much social distancing as possible. The district also recommends vaccines and boosters if possible. We've reached out to our other local counties. Their plans, we'll update you when we hear more about that. Well, it's the matchup we've all